I felt that the division here was very helpful, and Dr. Witness, the fellowship director, was in contact with me numerous times throughout the months leading up to my fellowship here to make sure that everything was progressing as it should be with the transition and offering any help and resources that I might need in order to make my fellowship start off successfully. I think the real challenge of fellowship is learning to balance out all the other responsibilities that come along with being a fellow, and that's pursuing your research interests and things like that. And doing that in a diligent fashion, because your time in fellowship is really relatively short in the grand scheme of things. It goes by very quickly, and so making the most of the opportunities that you're presented and your research opportunities is very important.
I also was able to come and visit the University of Iowa and had a lot of support from the faculty here. They were willing to buy me Avery's textbook and anything that I thought that I needed in advance of coming to help prepare me, and they sent that to me in the mail. It was very nice to come to a fellowship program where they allowed another senior fellow to work alongside of me in the NICU the very first month. It was difficult enough to learn new computer systems for electronic health records, and the nurses' flow sheets are all computerized. We had to learn how to set up transports, let alone how to get to the NICU and where everything in the hospital was. And so it was really nice to have another fellow there to help me along with those things, as well as the differences in clinical practice that happen from NICU to NICU. I had 2 weeks with one senior fellow and then 2 weeks with another senior fellow, and it was nice because each of them gave me input that was different. One really, went over ventilator things with me a lot, and the other, helped me with my organizational skills and getting used to how rounds functions in the NICU here at University of Iowa.
One of the things that the program does here that's very helpful is that in the initial month that you're here, you have the opportunity to shadow on service and to get a feel for the way the program ran. And so the first time I was on call, I didn't feel very overwhelmed at all. In fact, I've always felt very supported by the faculty here and by the division.
I think the definite pros are that this is an academic and research as well as patient-oriented fellowship. The fellows here are allowed to advance their clinical skills without doing busy work. We're not a service-driven fellowship, we're more of a patient-driven and learning-driven fellowship. So rather than being asked to write notes and do busy work, our time is spent working on patients, procedures, thinking about our skills, and learning directly. So that's definitely a big pro here. The other thing that I really love about things that are done here at the University of Iowa is that we have clinical division rounds where everyone comes together and we present patients that might be a little bit of a problem or more difficult to treat, and everyone puts their heads together and gives suggestions or ideas about the best management for the patient.
I think the ideal fellowship candidate for Iowa comes in with both interest in being excellent clinically and excellence in basic science or clinical research. I feel more and more that both opportunities are available to people looking at Iowa. I would say that one of the things that I can't overemphasize enough is that the opportunities that people have here at the University of Iowa, in particular in our Division of Neonatology and our fellowship, because of the commitment to academics and the commitment to fellow education here. As a first-year fellow, I had the opportunity to go to 2 conferences, and as a second-year fellow, I have the opportunity to go to at least 2 major conferences and overseas, and all of my academic goals have been supported.
They helped me to choose a research project by giving me information about the research projects that were here, and I started reading different articles that to see what I'd be interested in the most in Journal of Pediatrics and other research-oriented or academic-oriented magazines. Since I was mostly interested in clinical research, I wanted to find a topic that I liked and was interested in so that it would be something I could take on over the next few years.
I've very much enjoyed the lab experience. I do a project working with prematurity of genetics, and I wanted to, when I came here, have the opportunity to do a project that had a little bit of an international focus but was also basic science, and was able to find a mentor, Dr. Murray, who was very accommodating to those interests and actually handed me a very significant project dealing with premature babies from Argentina. I have enjoyed the lab. There's lots of people in it. It's a very big lab, and the academic environment and the culture of learning there has been great, and I feel very fortunate that I'll actually have opportunity to go overseas in the upcoming months to pursue my interest not only on the basic science standpoint but also the translational medicine standpoint.
I think the faculty and the fellows really work well together. We are definitely treated as part of the team and are allowed to make some decisions. And when the decisions that we make may not be the ones that the faculty make, it's nice that rather than just saying, I wouldn't do that because I wouldn't do that, we are given articles or evidence-based medicine to help us formulate that decision on our own.
I don't feel that any program takes care of babies any better than what we do. I feel clinically my training will be as solid as any program in the nation, and particularly for me, because I didn't have a lot of experience in residency with the micro-preemies. I feel coming here that having the opportunity to really see the way this division does ventilation management and other types of management in the small babies and our survival outcomes as a result has really prepared me well for whatever avenue I go into my career. I feel confident going forward that there isn't a medical condition or a patient or anything like that that I couldn't take care of. I feel Iowa does a very just a wonderful job of preparing people for whatever career, particularly for academic careers. All fellowships are required to have at least bi-yearly scholarship oversight committee meetings, and in these meetings you sit down with a career mentor, I sit down with my lab mentor, and then another person that's outside of our division, and they talk about the progress in my career, and they talk about my career goals and objectives. And that's a very helpful meeting. I think every time I have that, I gain new insight into what I could be doing, or what sort of things, what is the next step to kind of move me along in my interests. And because my interests are in academic medicine and in basic science research, the environment here for that has been phenomenal.
For fellows that are interested in neonatology, I think it's really important to ask the department what kind of a fellowship model they use. Is it a service-driven fellowship where you're going to be expected to be doing the busy work, or is it a learning-driven fellowship where you're going to be allowed to work more directly with patients and less focused on writing notes and busy work, billing and coding, those kinds of things that may not really add to your learning as much as it would be working with the patients directly? There's a lot of different cultural diversity here. There's a lot of different good restaurants and theater. There's sporting events to attend, so there's a lot more opportunities for my kids and for our family to develop our cultural and sports enthusiastic or sports enthusiasm here.
Iowa City is a great city for outdoor enthusiasts. There are miles and miles of running and biking trails here. I think no matter what your interests are, if they're cultural, there are opportunities, there are theaters here through the university, there's sporting events. If you grew up like I did in Big Ten territory, it's fun to be a part of that environment again and to have the opportunity to go to the football games or the basketball games, or just no matter what your interests are, I feel this town can foster them, and you'll find like-minded people with whom you can do things.